Well, consumers are not the only ones struggling to pay for popular GLP-1 medications. They're also expensive for the state. Now, leaders are pushing to bring those costs down with an alternative solution. NBC Connecticut political reporter Mike Savino joins us live from the Capitol. Mike, what exactly are they thinking?
Well, Amber, the state can only do so much to control costs with steps like limiting access for state employees or Medicaid recipients, especially when they have a prescription for this drug. So a new law puts the state on a path to try to make its own brand.
So we're looking for options. We're looking for affordability. We're trying to see what we could do.
GLP-1s remain popular as a necessary medication for people with type 2 diabetes and other conditions, and with those who see it as a miracle weight loss drug, but it comes with a high price for consumers and for the state of Connecticut, including an estimated $150 million just through Medicaid last year. Now the state is seeking the unprecedented step of getting into the drug-making business.
GLP-1s, as you know, is an accelerating piece of our budget because it makes a big difference in people's lives.
A newly passed state law tasks the Department of Social Services with asking permission from the federal government to partner with the drug company to make a generic form of the drug, citing federal law that gets around patent protections in certain situations. But a pharmaceutical industry trade group is pushing back, saying this would weaken vital patent protections and disincentivize future investments in life-saving medical innovation. One expert also questions if other manufacturers would find it worthwhile to partner with the state.
So I think they would need to make a determination that they're going to be able to make this drug, and then the time horizon that they'd be able to sell it over would at least be several years.
Senator Matt Lesser says it depends on what the federal government would allow. But he also notes Louisiana used a similar request to get companies to agree on cost-saving measures for hepatitis C drugs in 2019.
There are a lot of ways to skin a cat, but the important thing is that we are delivering relief for Connecticut taxpayers.
And I should note, we also recently heard back from the comptroller's office that the state spends another $60 million on state employee health insurance, bringing those costs over $200 million. Now, Lesser says that this is not about the state putting up money to support development or guarantee amount of business. Rather, the state would be able to take the approval that it owns as leverage to negotiate with a drug manufacturer who could help bring down the costs down the road. Live from the Capitol, Mike Savino, NBC Connecticut News.